51. A patient with type 2 diabetes asks about the purpose of HbA1c testing. What should the nurse explain? Answer: it measures average blood glucose over 2 to 3 months. Rationale: HbA1c reflects long-term glucose control, guiding treatment adjustments to prevent complications like neuropathy or retinopathy. 52. A patient with diabetes has a blood glucose of 600 milligrams per deciliter and is lethargic. What should the nurse prepare for? Answer: treatment for hyperglycemic hyperosmolar state, HHS. Rationale: extreme hyperglycemia and lethargy suggest HHS, requiring for fluids, insulin, and electrolyte management to stabilize the patient. 53. A nurse is reviewing a patient's insulin pump settings. What should the nurse ensure? Answer: the basal and bolus doses are correctly programmed. Rationale: proper pump settings ensure continuous basal insulin and appropriate bolus doses for meals, maintaining optimal glucose control. 54. A patient with diabetes reports frequent urination and thirst. What should the nurse assess first? Answer: blood glucose level. Rationale: polyuria and polydipsia are classic hyperglycemia symptoms, requiring glucose assessment to confirm and guide treatment. 55. A nurse is teaching a patient about preventing diabetic foot complications. What is a key instruction? Answer: avoid walking barefoot. Rationale: walking barefoot increases the risk of injury, especially with neuropathy, leading to infections or ulcers in diabetic patients. 56. A patient with type 1 diabetes has a blood glucose of 250 milligrams per deciliter before exercise. What should the nurse advise? Answer: delay exercise and check for ketones. Rationale: glucose above 250 milligrams per deciliter before exercise may indicate insulin deficiency, and ketones suggest risk of DKA, requiring caution. 57. A nurse is administering insulin to a patient with a blood glucose of 80 milligrams per deciliter. What should the nurse confirm? Answer: the patient has eaten or will eat soon. Rationale: administering insulin without food at a normal glucose level risks hypoglycemia, so meal timing must be confirmed. 58. A patient with diabetes asks about the role of fiber in their diet. What should the nurse explain? Answer: it helps stabilize blood glucose levels. Rationale: dietary fiber slows glucose absorption, reducing postprandial spikes and aiding in long-term glucose control. 59. A patient with a blood glucose of 45 milligrams per deciliter is confused. What should the nurse do first? Answer: administer glucagon if unable to swallow safely. Rationale: confusion indicates severe hypoglycemia. If the patient cannot safely swallow carbohydrates, glucagon is needed to raise glucose. 60. A nurse is teaching a patient about insulin pen use. What is a critical step? Answer: prime the pen before each injection. Rationale: priming removes air bubbles and ensures accurate dosing, preventing under- or overdosing of insulin. 61. A patient with type 2 diabetes is prescribed pioglitazone. What should the nurse monitor for? Answer: signs of heart failure. Rationale: pioglitazone can cause fluid retention, increasing heart failure risk, necessitating monitoring for edema or shortness of breath. 62. A patient with diabetes has a callus on their foot. What should the nurse advise? Answer: consult a podiatrist for safe removal. Rationale: calluses can hide ulcers or lead to pressure injuries. Professional removal prevents complications in diabetic patients. 63. A nurse is caring for a patient with DKA receiving 4 insulin. What indicates improvement? Answer: decreasing blood glucose and resolving acidosis. Rationale: effective DKA treatment lowers glucose and corrects acidosis, e.g., rising pH or falling anion gap, indicating metabolic stabilization. 64. A patient with diabetes asks about stress management. Why is this important? Answer: stress can raise blood glucose levels. Rationale: stress hormones like cortisol increase glucose production, potentially worsening control, so stress management is key. 65. A nurse is teaching a patient about sick day rules. What should the patient do if unable to eat? Answer: sip carbohydrate-containing fluids and check glucose. Rationale: maintaining carbohydrate intake and frequent monitoring prevent hypoglycemia or DKA during illness when eating is difficult. 66. A patient with type 1 diabetes reports weight loss despite increased appetite. What should the nurse suspect? Answer: uncontrolled hyperglycemia. Rationale: weight loss and polyphagia suggest insulin deficiency, leading to glucose loss in urine and tissue breakdown, requiring evaluation. 67. A nurse is preparing to administer insulin detamir. What should the nurse know about its duration? Answer: it lasts up to 24 hours. Rationale: detamir is a long-acting insulin providing basal coverage for up to 24 hours, administered once or twice daily based on need. 68. A patient with diabetes has a blood glucose of 90 milligrams per deciliter before bed. What should the nurse recommend? Answer: eat a small snack with protein and carbohydrates. Rationale: a bedtime snack prevents nocturnal hypoglycemia, especially if glucose is near the lower normal range, 70 to 130 mg/dl. 69. A nurse is teaching a patient about continuous glucose monitoring, CGM. What is a benefit? Answer: it provides real-time glucose trends. Rationale: CGM tracks glucose continuously, helping patients adjust insulin, diet, or activity to prevent hypo or hyperglycemia. 70. A patient with a diabetic foot ulcer reports fever and chills. What should the nurse do? Answer: notify the provider and prepare for wound culture. Rationale: fever and chills suggest systemic infection, requiring urgent evaluation, possible antibiotics, and wound culture to guide treatment. 71. A nurse is reviewing a patient's insulin regimen. The patient takes NPH and regular insulin. How should they be mixed? Answer: draw regular insulin first, then NPH. Rationale: drawing clear regular insulin before cloudy NPH prevents contamination of the regular insulin vial, ensuring accurate dosing. 72. A patient with diabetes asks about preventing retinopathy. What should the nurse emphasize? Answer: maintain tight glucose control and regular eye exams. Rationale: good glucose control slows retinopathy progression, and regular exams detect changes early, preserving vision. 73. A patient with type 2 diabetes reports leg cramps at night. What should the nurse assess? Answer: electrolyte levels and neuropathy. Rationale: cramps may result from diabetic neuropathy or electrolyte imbalances, e.g., hypomagnesemia, common in diabetes, requiring evaluation. 74. A nurse is teaching a patient about glucagon use. When should it be administered? Answer: for severe hypoglycemia when the patient cannot swallow. Rationale: glucagon is used in emergencies when a patient is unconscious or unable to take oral carbohydrates, raising glucose via glycogenolysis. 75. A patient with diabetes has a blood glucose of 180 milligrams per deciliter before a meal. What should the nurse do? Answer: administer insulin as prescribed and monitor. Rationale: premeal glucose of 180 milligrams per deciliter is elevated. Administering prescribed insulin, e.g., bolus, and monitoring prevents further hyperglycemia. 76. A nurse is educating a patient about diabetic nephropathy. What is a key prevention strategy? Answer: control blood pressure and glucose levels. Rationale: hypertension and hyperglycemia accelerate kidney damage. Tight control of both reduces nephropathy risk and progression. 77. A patient with type 1 diabetes is vomiting and has a blood glucose of 350 milligrams per deciliter. What should the nurse do? Answer: check for ketones and notify the provider. Rationale: vomiting and hyperglycemia suggest possible DKA, especially with ketones, requiring urgent evaluation and treatment. 78. A nurse is teaching a patient about insulin injection sites. What is the fastest absorbing site? Answer: abdomen. Rationale: the abdomen has consistent subcutaneous tissue and blood flow, allowing faster insulin absorption compared to arms or thighs. 79. A patient with diabetes reports tingling in their hands. What should the nurse suspect? Answer: peripheral neuropathy. Rationale: tingling is a common symptom of diabetic neuropathy caused by nerve damage from chronic hyperglycemia, requiring assessment. 80. A nurse is caring for a patient with hypoglycemia who is now alert after treatment. What should the nurse do next? Answer: provide a snack with protein and carbohydrates. Rationale: after correcting hypoglycemia, a balanced snack stabilizes glucose levels, preventing recurrence until the next meal. 81. A patient with type 2 diabetes is prescribed a GLP-1 agonist. What is a common side effect? Answer: nausea. Rationale: GLP-1 agonists, e.g., liraglutide, commonly cause nausea, especially initially, which often subsides with continued use. 82. A nurse is teaching a patient about diabetic meal planning. What is a key principle? Answer: balance carbohydrates, proteins, and fats. Rationale: balanced meals stabilize glucose by providing steady energy, preventing spikes or drops, and supporting overall nutrition. 83. A patient with diabetes has a blood glucose of 700 milligrams per deciliter and altered mental status. What should the nurse prepare for? Answer: treatment for hyperglycemic hyperosmolar state, HHS. Rationale: extreme hyperglycemia and mental status changes indicate HHS, requiring for fluids, insulin, and electrolyte correction. 84. A nurse is assessing a patient's insulin injection technique. What indicates a need for reteaching? Answer: injecting into the same site repeatedly. Rationale: repeated injections in one site cause lipohypertrophy, impairing absorption and glucose control, requiring site rotation. 85. A patient with diabetes asks about weight management. What should the nurse recommend? Answer: regular exercise and portion control. Rationale: exercise and portion control promote weight loss, improving insulin sensitivity and glucose control in diabetes. 86. A nurse is caring for a patient with DKA. What electrolyte imbalance is most likely? Answer: hypokalemia during treatment. Rationale: insulin and fluid therapy for DKA shift potassium into cells, causing hypokalemia, which requires careful monitoring. 87. A patient with type 1 diabetes reports missing a dose of insulin. What should the nurse assess for? Answer: signs of hyperglycemia or DKA. Rationale: missing insulin can cause hyperglycemia, potentially progressing to DKA, requiring assessment of glucose and symptoms. 88. A nurse is teaching a patient about preventing hypoglycemia. What is a key strategy? Answer: eat meals and snacks on a regular schedule. Rationale: consistent meal timing ensures steady glucose availability, reducing hypoglycemia risk, especially with insulin or sulfonylureas. 89. A patient with diabetes has a fungal infection under their toenail. What should the nurse advise? Answer: consult a podiatrist or provider for treatment. Rationale: fungal infections in diabetic patients can worsen or spread, requiring professional treatment to prevent complications. 90. A nurse is reviewing a patient's glucose log. What pattern requires intervention? Answer: morning glucose consistently above 200 milligrams per deciliter. Rationale: elevated fasting glucose, e.g., dawn phenomenon or inadequate basal insulin, indicates poor overnight control, requiring regimen adjustment. 91. A patient with type 1 diabetes has a blood glucose of 550 milligrams per deciliter and is vomiting. What should the nurse prioritize? Answer: assess for ketones and notify the provider. Rationale: vomiting and severe hyperglycemia suggest diabetic ketoacidosis, DK, requiring immediate ketone testing and provider intervention. 92. A nurse is teaching a patient about insulin lispro. What should the patient understand about its use? Answer: it is taken just before or after meals. Rationale: lispro is rapid-acting, with an onset of 10 to 15 minutes, making it ideal for controlling postprandial glucose spikes when timed with meals. 93. A patient with type 2 diabetes has a blood glucose of 62 milligrams per deciliter and feels shaky. What should the nurse do first? Answer: administer 15 grams of fast-acting carbohydrates. Rationale: mild hypoglycemia requires 15 grams of fast-acting carbohydrates, e.g., juice, to raise glucose, with rechecking after 15 minutes. 94. A patient with diabetic neuropathy reports a cut on their foot. What should the nurse advise? Answer: clean the wound and seek medical evaluation. Rationale: neuropathy impairs healing and sensation, increasing infection risk. Prompt cleaning and evaluation prevent complications. 95. A nurse is preparing to administer insulin glargine to a patient. What should the nurse ensure? Answer: it is not mixed with other insulins. Rationale: glargine's unique pH makes it incompatible with other insulins, as mixing alters its action, affecting glucose control. 96. A patient with diabetes reports fatigue and a blood glucose of 450 milligrams per deciliter. What should the nurse suspect? Answer: hyperglycemia. Rationale: fatigue is a common symptom of hyperglycemia caused by glucose buildup and dehydration, requiring assessment and treatment. 97. A patient with type 2 diabetes is on metformin. What should the nurse teach about alcohol use? Answer: limit alcohol to avoid lactic acidosis risk. Rationale: excessive alcohol with metformin increases lactic acidosis risk, a rare but serious complication, necessitating moderation. 98. A patient with diabetes has a blood glucose of 48 milligrams per deciliter and is alert. What is the nurse's priority action? Answer: administer 15 grams of fast-acting carbohydrates. Rationale: hypoglycemia in an alert patient requires 15 grams of carbohydrates to raise glucose safely, followed by monitoring. 99. A patient with a diabetic foot ulcer reports pain and swelling. What should the nurse do? Answer: notify the provider and elevate the foot. Rationale: pain and swelling suggest infection or worsening ulcer, requiring urgent evaluation. Elevation reduces swelling pending assessment. 100. A nurse is teaching a patient about insulin vials. How should open vials be stored? Answer: at room temperature for up to 28 days. Rationale: opened insulin is stable at room temperature for 28 days, ensuring convenience while maintaining potency if not exposed to extremes.